All right. Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, The Dangers of Too Much Sun Understanding Skin Cancer, is presented by Dr. Divya Day. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of this presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups or other resources, or for additional dates and time, please call 1-844-472-8499. And I am now going to turn it over to Dr. Day.
Hi, everyone. My name is Dr. Day. I'm a dermatology resident physician. I'm so excited to be here today to give you this talk on one of my favorite topics, skin cancer and sun protection as we go into the summer months. So I'm going to start off with some basic teaching first. I have a lot of pictures for you guys, and then I'll go into more of like how to prevent skin cancer, some of the treatments, and some sun protection tips for you. So what is skin cancer? So giving this talk is really important to me because skin cancer is one of the most common cancers in the US. And around 20% of people will develop skin cancer in their lifetime in the US. So what causes skin cancer? So the basic answer is UV radiation from the sun. So certain people can have other factors like genetics that play a role, but the number one thing is UV rays causing skin cancer and accelerating it. What happens is that over time, exposure to UV rays can cause damage, and this leads to changes on a genetic level in our skin. And so we can see changes as we get older, like skin texture changes, premature aging, and ultimately skin cancer. So here's a more microscopic view of the skin. The top layer is called the epidermis, and the bottom layer is called the dermis, and that's what makes up our skin. And we have a lot of different cells within these layers that contribute to a lot of different functions that we have of the skin. But these are places where we can get potential skin cancer. So the most common ones are squamous cell skin cancer, basal cell skin cancer, and melanocytes. So I'm going to go into some of the risk factors. So these are some of the main risk factors in developing skin cancer. Not to say that people that don't have these can't develop skin cancer, but this can make you more prone. And these are some of the people, anybody who has these features, I recommend getting a skin check every year. So if you have lighter skin tone, if you have skin that burns, freckles, or reddens easily, and you're very sensitive when you step out into the sun, if you have blue or green eyes, blonde or red hair, certain people are also have a lot of moles, and a certain type of mole that we call a typical mole, and they're just kind of funky looking. So these people can also be more prone to developing skin cancers. And if you have a family history, of course, a personal history as well. And as we get older too, our risk of skin cancer increases. So now I'm going to go through some pictures and characteristics of the most common types of skin cancers. So as a dermatologist, the way we learn is through looking through a lot of pictures. So I'm hoping by the end of this, you can be an expert in recognizing some of the warning signs and when something feels off, and using that gut feeling to protect yourself and getting checked out by a dermatologist. So first, we're going to start off with squamous cell skin cancer. So there's lots of different variations on how squamous cell can look. So first we have like a rough reddish scaly area that people develop. This can really easily be confused with a patch of dry skin or eczema. It can be an open sore looking lesion. It can also hide in like a brown spot that looks like an age spot. So it can be very sneaky in that way. This is a more obvious growth that can form. from squamous cell. And sometimes there's actually growths that look like other things that we see in derms. So squamous cell can sometimes hide in things that look like warts. And also similarly horn-looking type of lesions that grow on people. This could be one of the things that we, want to rule out squamous cell for. And then also with any old scars that you have, if people notice that there's like a sore forming in an old scar, we would want to be careful and make sure it's not squamous cell. So now let's move on to basal cell carcinoma. So one of the ways basal cell can look, these are very tricky. They can be very subtle. So this is a pink colored growth. This actually dips into the skin. We call this atrophic. And when we see this, we want to rule out basal cell carcinoma. It's very common to be near the ears, so it can look like a scaly area near the ear that's like non-healing, doesn't go away. Again, just like squamous cells, sometimes people can confuse this for like dry skin or something like that. It can also trick people because it can look like a pimple or a sore, but the key factor is that this is something that won't heal, or it will heal and it'll come back. So with any pimple, anything like that on your face, usually if it's benign, it will heal and you won't see it again. But something that clues us in, that's kind of like a warning sign, is something that's not healing or it's coming back. It can even just look like a scaly raised area of skin on your face. And it can hide in a bump that's the same color as your skin as well. Or it can look like a scar, like in this picture. So then we have melanomas, and melanomas are formed from melanocytes, as I mentioned. So these are the cells in our skin that produce pigment. So a lot of the times melanomas are going to have a darker color to them compared to the squamous cells and basal cells that, have a more reddish tone or a skin colored tone. Melanomas are usually have a lot of pigment. So you can see in some of the pictures here, they're very darkly colored. And the one thing that I want you to remember, the most important thing to take away is the mnemonic A, B, C, D, E, and I'm going to go through it, especially because squamous cell and basal cell, they're very common, and we can excise it from our skin, and there's very, very good cure rates. Melanoma as well, caught early has very good cure rates, but it can progress very rapidly. So we want everyone to be aware of this mnemonic so they can go in and get checked out by their dermatologist. So the A stands for asymmetry. And this is simple, like a normal mole that you have, it's going to be symmetrical. If you cut it in half, it'll look the same on either side. If it's an oval, if it's a circle, it's going to look symmetrical. You can see in this picture that a melanoma, it's going to look asymmetrical. And that's something to clue you in that there's some abnormal growth there. So the B in this mnemonic stands for border. So normal moles will usually have a smooth border. It'll look like round like a circle or even an oval. It'll be a very smooth shape. In melanomas, you start to form irregular borders. So you can see in this picture, this is not smooth looking. It's very irregular, very jagged, very poorly defined. And the C is for color. So as I mentioned, these are coming from melanocytes, which produce pigment. So when there's this abnormal growth, there's a lot of different colors that you can see. Normal moles will be one color. If you have a lot of moles on your body, a lot of them will look the same color too. Like throughout your whole body, you'll have like a certain like typical mole that you grow for yourself, and they'll all look a similar color. But in melanomas, you'll see that there's very different colors. It can have brown, it can be very black. There can even be areas that are white within it, like you can see in this picture, or even red and blue. So when we look under our dermatoscope, which is a microscope that's handheld that your dermatologist will look under, we can kind of see all these colors. But even to you, when you're kind of doing skin checks, you can see there, it won't look like your typical mole. Diameter is the D. So size is something we consider too when we're looking, screening for melanomas. So usually anything bigger than 6 millimeters, so we say the top of a pencil eraser. Anything bigger than that, and if it's growing big, I would get it checked out by your dermatologist. It can be smaller too, and that's why you go to get skin checks from your dermatologist, but this is something that you can look out for a really big mole or something that's growing into a bigger shape. And the E in this is for evolving. So say you've had a mole for a long time and now you've noticed that as you're getting older, it's kind of changing. It's having some of those warning signs that I talked about, like it's becoming asymmetrical. The border is looking a little weird. The colors are changing. Normal moles don't do that. Normal moles, you'll grow it, usually when you're younger, and it'll stay the same throughout your whole life if it's benign. So when it's changing like that, that is a warning sign that you want to go to your dermatologist. So when do you want to go see your dermatologist? So I recommend everyone start by getting one skin check in your 20s to start with as a baseline. And then based on your family history, your risk factors that I mentioned before, and your medical history, your dermatologist kind of is going to guide you on when to follow up. So there's people that have a lot of skin cancer history and will want to see them in 3 to 6 months, especially if they've had excisions, they've had surgeries. We'll want to see them more often. And then there's some people who, we come in, they don't have many moles, they don't have a lot of the risk factors, and we can even go up to 5 years. Usually it's an annual skin check, so that's what I recommend for most people, but your dermatologist will guide you on how often to come. It really depends on you. And the main thing I want you to take away from this lecture is that if you're noticing changes in your skin, I want you to trust your gut and go see your dermatologist. So if there's something growing, if there's a mole that's changing, there's something that's been bothering you for weeks and it's not really going away, it's time to see your dermatologist because they can take a better look under the microscope and tell you if it's okay. So these, I'm summarizing on here basically what I went over with the pictures, but the growth, the mold that's changing, a spot that's continuing to give you symptoms like itching, it's hurting, crusting or scabbing, and an open sore that's not healing. So self-skin checks is something that I recommend you do, especially if you've gone to a dermatologist for a skin check and they found things that they want to watch. I recommend people do a skin check once every month. So what you need for this is pretty easy. You need just a bright space, a bright light, a full length mirror and a handheld mirror so you could see the back of you. I would do it about once every month. And the most important thing is that you have a systematic approach. And this is what I do too when I do skin exams on patients. I have a similar pattern that I go through every time so I don't miss anything. So first you can start by looking at your whole body. Then I start from the top down, so head to toe. So you do your face, your neck, your scalp. You can do your arms and hands. Move on to the front of your body, your chest and abdomen, and then the front of your legs. Make sure you're checking, like when you're checking your arms and hands, make sure you're checking your palms. And then when you're on your feet, make sure you check your toes and the soles of your feet because sometimes melanomas can hide there. And then you want to use your hand mirror, kind of put it behind you and you want to put it in front of you. You want to face the back of the mirror and kind of take a glance at your back. And it's not the same thing as going to a dermatologist, but it is really helpful when patients do this and you come in and you can kind of say what what your concerns are. And it's good for you to be looking out for yourself. So I do like when patients do this. So now the treatment for skin cancer, it really depends on what type you have. So with the 3 that I described, the most common ones that we see, squamous, basal, and melanomas, there's like hundreds of different variations even within those categories. And we have specific treatments for each type of variation. So typically we determine treatment by looking at it clinically, like how does it look? How long has it been going on? What symptoms is it causing? And we'll even take samples from the skin. So those are called biopsies, to send it to a lab to see what kind of skin cancer you have. They look at it under a microscope. A dermatopathologist who's an expert in looking skin cancers under the microscope. And then all the treatments that I've shown here are done in office with local numbing. So curettage and electrodesiccation, that's kind of where we numb your skin up. We just scrape your skin and kind of use electricity to get rid of the skin cancer. Cryosurgery is just freezing with liquid nitrogen. And then there's surgical removal, so excision and Mohs surgery. Excision and Mohs surgery both are done in office. Mohs surgery is a specific type of surgery that a Mohs surgeon does, and these people are board certified in removing skin cancers. So depending on what you have, you might get one of these. But the good thing with skin cancer, as I said before, is that, you know, when you're following up with your dermatologist and you're getting your skin checks, if you are found to have a skin cancer, there's very good outcomes, especially early on once you remove it. Very good outcomes with these treatments. So now I'm going to give some tips on protecting yourself from the sun, because of course we have really good treatments, but the best treatment is prevention. So I'm going to go into some of that. So these are just some general tips. So you really want to avoid prolonged exposure to the sun when possible. You want to wear a sunscreen every time you're out with a minimum SPF of 15. Honestly, I would even recommend minimum of 30, and I'll get into that later. If you're going to be out in the sun, you want to wear clothing with a very tight weave or high SPF clothing. You can actually you know, purchase high SPF clothing, long sleeves, long pants, to really protect yourself, even on top of doing sunscreen. You want to protect your scalp and your head. So I always recommend wide brim hats, with UV protection. They sell specific ones with UV protection. And you want to you can get ones with side panels as well, which is really good. And I have a picture here of a visor. If you're really going to be out for a long time, I do recommend that to some of my patients. And make sure you take breaks in shaded areas. You want to find the shade. You don't want to be out. You don't want to be burning. Just, you know, these are kind of things, common sense things that you can do where you really want to reduce your sun exposure. So people ask, is there a difference between chemical and physical sunscreen? The short answer is no. So mineral, I have a little graph here. There's two types of overall sunscreens. There's mineral sunscreens, and those are ones with the ingredients titanium dioxide and zinc oxide. And then there's also chemical sunscreens, and these are like the oxy benzones you'll see in the ingredients list. So mineral sunscreens, they work by deflecting rays off your skin. And chemical sunscreen works by absorbing the rays from your skin. But they both work very well. Typically, mineral sunscreens I recommend for people with more sensitive skin. And chemical sunscreens, a lot of people prefer because they have like a better cosmetic appearance and they don't leave that white cast on people. So the best sunscreen really is the one that works for your skin and you're going to wear every day. And I recommend for patients, sunscreen is just should be like brushing your teeth. Every morning you should be putting it on. A lot of people ask if they have to reapply. If you're going to be out in the sun in the middle of the day, you know, for extended period of time, I would recommend reapplying, but for just every day, I would recommend putting it on when you're, you know, for your morning routine, and just doing that every day. And even that gives you a lot of protection. So more important than which sunscreen you're using is how you're going to be applying this sunscreen, because sunscreen, you know, can be affected by like the weather, wind, humidity, if you're sweating a lot, and proper application is the most important thing. So you want to be very liberal with the amount you apply. You don't want to skimp out here. Like sometimes I'll even do 2 layers of application just to make sure that you've really covered every single part of your skin. And you want to apply it 20 minutes before, 15 to 20 minutes before you go out in the sun. And don't forget like the areas like the ears, the scalp, your lips, your neck area, and like the tops of your feet and hands, because this is where we see a lot of skin cancer. And we can see a lot of sun damage just because, you know, even though we're putting sunscreen on our face and most of our body, these are kind of areas that we tend to miss. And it's kind of hard with like the scalp, with your hair and like lips and things like that. So with the scalp, there are powder sunscreens that I recommend to people that you can put in on your hairline. There's also spray sunscreens that you can use that won't mess up your hair as much. And then getting chapstick that has UV protection as well, and just keeping that in your bag and using that daily. And you want to make sure if you're really doing, like if you're really out, you're at the beach, you're at a water park, like reapply every 2 hours, because just applying the once in the beginning of the day is not going to be enough here because you're going to be sweating, you're going to be in water, you need to reapply. And then obviously regularly look at your expiration date and throw away any that are very old because they won't be as effective. So now I'm going to go over some myths, some common sun myths. These are common questions that I get in the office. So I felt like it would be helpful to go over. So the first myth I hear very often is I need to get sun exposure to get vitamin D. And this is just not true because the amount of time that we would even need to be in the sun daily to get proper vitamin D, it would be a lot. It would be a lot of hours. So for everyone, I recommend vitamin D supplementation through diet and like vitamin D pills. And you can ask your primary care doctor to recommend a dosage for you if they want to check your level. But usually everyone in America is deficient in vitamin D. So you can ask your primary care what dosage you should take, but vitamin D really should be through diet and supplementation. The sun exposure is not enough, and it just increases your risk for skin cancer. So the next myth is when it comes to sunscreen, the higher the SPF, the better. So usually I do recommend minimum SPF 30. So you'll see here, SPF 30 is 97% protection. When you go up to 50, it's 98, and 100 is 99. Usually the cost difference between SPF 30 and SPF 100 is a lot. Usually SPF 100 is way more expensive, and I don't think it's necessarily worth it because you're already getting 97% coverage with the SPF 30. So I recommend everyone choose at least SPF 30. And the most important thing, as I mentioned, is good application techniques and trying to stay out of the sun and wearing protective clothing. So doing all those in combination, I think, is more helpful than going for a higher SPF. Sunscreen contains harmful chemicals. So the FDA considers sunscreens to be safe and effective. I know there's a lot of concerns about certain chemical sunscreens, especially being endocrine disruptors. They can affect your hormones. These were small studies that were done. We don't really have large studies on it. We know skin cancer is very, very bad, and we have a lot of studies on that, but we don't have really good data proving that any sunscreens on the market, like chemical versus mineral, are better or worse. If you do have any concerns, I just recommend that my patients wear mineral-based sunscreens. So yeah. Only older people get skin cancer. This is a common myth that I see, but we have a lot of patients coming into our office, younger patients in their 20s, 30s, with melanomas. So melanoma is actually the most common form of skin cancer for people in their 20s. That's why I recommend everyone get at least one skin check in their 20s, because if you have a lot of risk factors, then we can monitor you more closely. And this can save someone's life, because usually people don't think that you can get skin cancer in your 20s, but if you've had a lot of UV ray exposure when you were a child, if you were on the beach a lot not wearing sunscreen when you were little, you do have increased risk. A base tan prevents sunburns. I hear this a lot. It's not true. So tanning happens whenever the body senses that UV ray damage and it's trying to protect you by tanning. But the damage at that point is already happening, and the UV rays are already hurting your skin. So there really is no safe tan. You want to be safe. You want to apply sunscreen anytime you're going out. There really is no safe tan. Anytime you have a tan, it means that you have some UV damage. You don't need to wear sunscreen in the winter on a cloudy day. I hear this from a lot of people, but really skin protection should be year round. That's why I recommend it in a morning routine, like every single day, 365 days of the year. Because UV rays can penetrate through clouds and there's damage that we can't see. So as I said, literally every day, just make it part of your morning routine, then you won't forget. And you should do it summer, fall, winter, spring, every single month. Okay, thank you everyone for joining. I hope everyone stays safe and sun protected this summer.
So I would like to say thank you all for joining us today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Dr. Day for dedicating your time and expertise today. If you have additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499. That concludes today's webinar, and I hope you all have a great day.
Thanks, everyone.